Welcome, everyone. Thank you so much for joining us here today. My name is Sierra Sanchez, and I'll be behind the scenes helping to produce this webinar. Connect with the campaign for grade level reading on social media. On YouTube, subscribe to our channel at Grade Level Reading. On LinkedIn, Facebook, and Instagram, follow us at Campaign for GLR. And on X, follow us at Reading by Third. Please use the hashtag Learning Tuesdays and tag us to tweet anything you learned from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Before we get started, I just wanted to take a moment to acknowledge our enterprise and programmatic funders, as well as our individual donors. Your support not only allows us to hold these vital conversations, but also helps us create meaningful opportunities to share insights, foster connections, and build the GLR community. Thank you. And as we get started, I have just a few housekeeping tips that I want to share with all of you. First, we would love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here and can see each other's chat messages. We also encourage you to share your thoughts and insights throughout the duration of the webinar. All attendees are in listen-only mode, but we encourage your engagement by posting questions in the Q&A box. We will dedicate the last portion of the webinar to respond to the questions you pose during the discussion, and our panelists will be typing out responses throughout the conversation. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any slides, bios, and resources, will be sent in a follow-up email to all who registered. And lastly, we'll be posting a brief on-screen poll during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. So thank you in advance for filling that out. And before we get started, I just wanted to turn your attention to some of our upcoming webinars that we have. Next week on May 20th, we have an exciting doubleheader. First, a funder-to-funder conversation, where we will be partnering with Hispanics in Philanthropy to host a webinar exploring the role that philanthropic organizations and collaboratives can play and are playing to mitigate the negative impact of changing immigration policies and practices, including accelerated deportation. That same day at 3 p.m., we'll have a discussion looking into education savings accounts and looking at what that consists of with high expectations and continuing concerns. And on May 27th, we'll be continuing our series of More Hopeful Futures or Children as Collateral Damage, this time with a session on Head Start as a cornerstone for early learning and development. Those registration links and more information will be posted in the chat box now, and we hope you can join us. And now I have the opportunity to introduce Dr. Robert K. Ross, who will act as our moderator for today's conversation. Bob served as President and Chief Executive Officer of the California Endowment, a private statewide foundation to address the health needs of Californians. Dr. Ross has been involved in community and professional activities at both the local and national levels, including being elected to the AIR Board of Directors in 2024, serving as founding board member of Covered California, chair of the Los Angeles County Task Force on Alternatives to Incarceration, and on the President's Advisory Commission on Educational Excellence for African Americans and the Diversity in Philanthropy Coalition. No free time is what it seems. A link to Bob's bio will be placed in the chat box. Bob, I welcome you to join us, and thank you again for sharing your time and expertise today, and I'll turn it over to you. Thank you.
Thank you, Sierra, and good morning. I guess good afternoon where you are. I'm in Huntington Beach, California, but good morning to the warriors and advocates of the fantastic and terrific campaign for grade level reading across the country. An important and timely webinar today with an issue that is important to each and every one of us on this call and in your work as advocates for children and families. I want to just acknowledge before I get into my framing comments. Thank you, Sarah. Thank you, Michelle. Thank you, Sarah, for organizing and providing the logistical leadership and support for these and other webinars. And a shout out to my friend and colleague, long 40-year plus colleague, Ralph Smith. He and I have been in the trenches from various perspectives, fighting for um, cobbling together a system of support and thriving and nourishment for children and families at the intersection of health and education and social services. So thank you, Ralph, for your enduring leadership, my friend. A timely moment that we find ourselves in for various reasons, but let me start big picture. 200 years ago, a French sociologist named Alexis de Tocqueville arrived at the United States to study how this new democracy for all was going. It was in the 1820s. At that time, Europe was led by monarchs and kings and queens and czars, and the United States was this fledgling adolescent trying to learn how democracy for all works. And in his book, Democracy in America, which is not an easy read, but he makes some salient observations about where America was at the time. He kind of gives America a grade of incomplete in trying to assert a for all representative democracy. We still had slavery, which he noted at the time that would have to be fixed. But for all of the promise and struggles of an 1820s America, he did offer this quote, which reminds me of our conversation, a good frame for our conversation today. And he said, "The greatness of America lies not in being more enlightened than any other nation, but rather in her ability to repair her faults." Repair her faults. And he presently reminded us at that time that a thriving for all democracy is a long game. And here we are 200 years later, still trying to get many of these elements right. FDR tried health for all in the 1920s and 30s, was not successful. Truman gave it a try in the 1950s, was not successful. But in the 1960s, Lyndon Baines Johnson provided leadership, first in 1964 on the Civil Rights and Voting Rights Act, followed by the advent of Medicare and Medicaid in 1965. And so now Medicaid is 60 years old. It continues to address a key fault going back to Tocqueville in our nation, and that is we don't have a national policy that assures health care and health coverage for all of its citizens and residents. And so today, this is a program that serves more than 75 million Americans, more than 35 million children, including 7 million children plus in the CHIP program. And we now find ourselves at a 60-year moment in the Medicaid program, re-examining the impact, the present, and the future of this incredibly important program for children and families. It is under heightened scrutiny and public debate. It's critical that we understand what is truly at stake, and this is what the purpose of today's webinar is. And Medicaid's impact goes beyond the doctor's office and goes beyond the matter of just coverage. It touches school-based health services, supports children with disabilities. It sustains healthcare providers in under-resourced communities, and it's the backbone of our public systems, both on the health side and on the education side and the social services side. And we pull on that thread, the entire fabric begins to fray. So today's conversation will explore how Medicaid policy connects directly to educational opportunity, to family stability, to long-term community health. And we hope that this session equips you with some insights and a renewed sense of urgency as this program is now budgetarily under debate at the federal level to ensure children remain at the center and not as collateral damage in these critical policy decisions. We have an incredibly terrific panel today. I couldn't think of a better group of well-placed individuals and professionals to speak to the issues the challenges that Medicaid faces today. We have Paula Andahar, who is a senior policy specialist at the National Association for the Education of Young Children, also known as NACY. We have Ann Dwyer, JD MP, who's an associate professor, research professor at the Center for Children and Families and at the McCourt School of Public Policy at Georgetown University. We've got from Utah, Mo Hickey, executive director of the Voices for Utah Children. And we've got the Honorable Jessica Schubel, former special assistant to President Biden for healthcare and founder of Day One Strategies. Each of these individuals spending an enormous amount of advocacy, energy, passion, and time on the matter of the future of children and their well-being. And so I just want to thank each and every one of them for joining us today. I will start off by providing Ann Dwyer, Ann Dwyer, with an opportunity to frame where Medicaid is today through data and insights and its impact on child health and development. So let's hand this over to Ann. And Ann, take it away. What does our audience and colleagues need to know about children and Medicaid and CHIP and the broader impact of Medicaid beyond direct healthcare services?
Great. Yes. Thank you, Dr. Ross, for that powerful introduction and for having me here today. So I'm going to talk a little bit high level briefly about what's kind of going on at the federal level, and then take it back a step to talk about why Medicaid is so important and the role it plays in coverage for children and families across the country. So as Dr. Ross highlighted, there is a lot going on at the federal level. So as we speak, they should have started actually about an hour ago. The House Energy and Commerce Committee on Capitol Hill is having a markup of their hearing on the reconciliation, their draft reconciliation bill. This language was just released a day or two ago, so lots of folks unpacking it. But I did want to highlight that according to preliminary estimates from the Nonpartisan Congressional Budget Office, the E&C Committee's draft bill would cut at least $715 billion in federal spending over the next 10 years, with a vast majority of that coming from Medicaid. In addition, the, again, nonpartisan independent Congressional Budget Office has noted in their analysis of this draft text that 8.6 million people will become uninsured as a consequence of the bill's Medicaid and ACA marketplace provisions, with the Medicaid policies in the bill driving nearly all of those coverage losses. This, combined with the expiration of the Enhanced Affordable Care Act marketplace subsidies and other ACA-related provisions, and another committee's version of the bill that will all kind of get combined together at the end, coverage losses, if this were to move forward, would be well over 14 million people, according to estimates. But again, before we kind of get into more discussion, which I know we will today, about some of the federal debate and the impact on Medicaid, I wanted to provide a bit more background on the role that Medicaid plays in the U.S. healthcare system, and particularly for children. So as we can see on this slide, Medicaid covers about half of children across the country. This includes all children in foster care. It also covers about half of children with special health care needs. A lot of folks don't realize that you can have private insurance and Medicaid, and there are children with special health care needs who have private coverage, but that coverage is perhaps unaffordable, high deductibles, or often, especially for children that need, home and community-based services, long-term services and supports, not comprehensive. And they also rely on Medicaid to help ensure that they get the things they need. Medicaid, as I mentioned, is also it's the primary payer of behavior or long-term services and supports in the United States. So Medicare, I think a lot of folks think of Medicare as the aging program, which it is, but Medicare does not cover a lot of long-term services and supports, including much of longer nursing home stays or home and community-based services. Medicaid is the primary payer of those services in the U.S. And as I was about to mention, Medicaid is also the single largest payer of substance use disorder treatment and mental health services. And it really plays a key role for both rural and urban communities. In fact, according to a recent CCF report on kind of rural impact, non-elderly adults and children in small towns and rural areas are more likely than those living in metro areas to rely on Medicaid and Medicaid's smaller but important sister program, CHIP, for their health coverage. And finally, as we've seen with COVID-19 and Hurricane Katrina, as well as other natural disasters, Medicaid plays a really important role when it comes to addressing pandemics and natural disasters. Next slide. So the next few slides, I'll move forward a bit more quickly, but I wanted to call out a few specific areas in more detail that I mentioned. So as Dr. Ross mentioned, Medicaid plays a really important role when it comes to services across child-serving systems. So in addition to healthcare, Medicaid plays a role in supporting the education system by covering Medicaid-based school services, as I mentioned, disability services, but also a very large role in the child welfare system, as well as many others. Next slide. And when it comes to kids, Medicaid and CHIP provide health coverage to about half of all kids, as we can see here, is by far the largest source of health coverage for low-income children under 6. So this is looking at children under 200% of the federal poverty level, under the age of 6. Medicaid and CHIP coverage is about 75% of those kids. So again, a really important program for millions of children across the country. Next slide. And also, as I mentioned, Medicaid is the primary payer of covering about 40% of paying for about 40% of births across the nation. This can vary. So we have this information on the CCF website, but you can look at your state here. Many states, Medicaid pays for well over 50% of births in a state. So those are kind of highlighted in the darker blue on this map. So again, a really important program when we're talking about coverage of pregnancy-related care in the United States. Next slide. And of course, in addition to coverage for pregnant individuals and for children, Medicaid also plays a really important role in covering other individuals as well, both working-aged adults and older adults. So overall, Medicaid provides health coverage to about 72 million low-income children, adults, and seniors. And this includes many low-income parents, many of whom are covered through Medicaid expansion pathway. So sometimes Medicaid expansion pathways talk about kind of like single childless adults, but the reality is that many low-income parents in many states are covered through the expansion pathway. And we can kind of see that gap here on this chart between the light blue line, where in states without Medicaid expansion, they're only covering low-income parents up to about 34% of the poverty level, which is a very low amount. Whereas parents in expansion states have that coverage up to 138% of the poverty level. Next slide. And when it comes to Medicaid and students, Medicaid is critically important. So it provides students with access to the care they really need to show up for school ready to learn. So for example, children covered by Medicaid are more likely to receive the preventative health care that keeps them in school, annual checkups that allow them to participate in sports, and treatment when they are sick or injured. And all these benefits really add up to stronger, healthier students, boosting both school achievement and economic prosperity as adults. So in fact, research shows us that students eligible for Medicaid are more likely to graduate from high school and complete college than students without access to healthcare. And if you're interested, as you can see on this kind of graphic on the right here with the lots of dots, we have Medicaid and CHIP coverage by school district, by state on our website. So if you are interested in your state by school district Medicaid and CHIP coverage, feel free to check out our website and track that down, and you can get a sense of how many children in that school district are covered by Medicaid and CHIP. Next slide. And when it comes to this longer term impact, we also see that one study found that increases in Medicaid eligibility at birth lead to improvements in reading test scores in the 4th and 8th grades. Another analysis found a boost in children's reading scores when their parents became newly eligible for Medicaid coverage. So we know that connection. Children whose parents are covered are more likely to be covered themselves. And this long-term investment goes well beyond the immediate school years. So for example, 2023 Congressional Budget Office analysis, again, this is this independent nonpartisan office, found that just one extra year of Medicaid coverage during childhood leads to higher earnings and better productivity as an adult, boosting the nation's economy. Next slide. So I will wrap up there because I know we have a lot to cover today. And I'll just know we have, as I mentioned, a ton of resources on the CCF website. So we have a number of mini briefs, including on Medicaid and students, one on Medicaid's role in child, youth, and adult mental health, one on Medicaid and early intervention, as well as a recent mini brief with NACI and CLASP on the role that Medicaid plays in supporting the early education child workforce. In addition, as I mentioned, we have longer reports with lots of state-specific data on varying issues, including our recent report on Medicaid's role in small town and rural areas. Next slide. So finally, for more data and information, definitely check out our website. We have state-by-state general coverage data in addition to that school district coverage data. We have coverage data by congressional district. And we also have a really great state data hub on our website. It's at one of the tabs at the top where you can pick your state and see a bunch of coverage data along with lots of different policies that your state has elected or not elected to pick up in the Medicaid and CHIP space. And we even have a comparison tool where you can kind of look at choose like your, a state next door to see how your state compares to other states. So with that, I look forward to talking more about how all of this relates to kind of the current federal debate, and I'm happy to turn it back to Dr. Ross. Thank you so much.
Thank you, Ann. That was with surgical precision. Thank you and in a way that was accessible, getting our audience to fully understand the scope of the Medicaid program. I wish I had the power to teleport you in that presentation right into the Capitol today, so you could give that presentation to our elected officials and just educate them about further educate them about the importance of this program. One question before I invite Jessica in. You mentioned that there's a proposal for $780 million in cuts. What proportion of the Medicaid budget does that proposed cut represent, roughly?
So yeah, it's about 715 billion. I could go back and check. There was different targets out there. Yeah, sorry, we just got the language about a day ago. It will depend on the state in terms of impact. But just as a reminder for folks, Medicaid is a state federal financed program where the federal government picks up, I want to say it's like 67 cents on the dollar on average. So for every dollar a state spends, the federal government will pick up about 67 cents, and the state picks up the difference. That means for every reduction in the federal dollar that the state's going to lose even more, right? They're going to lose proportionally more than that. And so the state can either raise taxes, cut benefits, cut eligibility, cut provider payments, or take from other parts of state budget programs. So like K through 12 education to make up those gaps. So they really have limited choices when that federal funding is reduced to kind of make up those budget gaps. And as we know, many states operate on balanced budgets within like a 1 or 2 year window. So, this could create really difficult decisions for states if these levels of cuts were to move forward. But we'll have more. Again, the language just came out like, I think at 10 o'clock on Sunday night. It's a great Mother's Day gift to me. And so we're still analyzing it, and more to come on kind of state specific impact as we kind of unpack the language and the different policies and what it means.
So the real impact as it gets closer to children, families, and states is not just mathematical. It's actually not just additive, it's exponential.
That's right. And this is only over a 10-year window. And many of these policies don't go into effect for like the first few years. So if you look over the next 10-year window, these don't just shut off after 10 years. They keep going, and effects, again, would be exponential and increase even further beyond that initial 10-year window.
Thank you. Thank you so much. And let's invite Jessica into the conversation. Welcome, Jessica. Can we get... Oh, Jessica's on screen. Terrific. She's with Day One Strategies, former White House senior advisor. And so, Jessica, let me pose the first question to you. Ann did a terrific job of sharing some of the broader community impacts of Medicaid. Can you also share, on the positive side, what are some of the recent advancements in school-based Medicaid services and how those services fit into the broader health ecosystem?
Sure, happy to. I was fortunate when I started my Medicaid career to work at the District of Columbia's Medicaid agency. And one of the things that I did there was I went around to all of the schools in the city to teach them how to bill Medicaid. And it was a very challenging assignment and one in which stuck through with me throughout my career of, if there was ever a time in my career where I could have the opportunity to fix this and make it simpler, I was going to try and do that. And luckily, for 4 years, I had a boss who was very committed to making sure that we were doing everything we could for kids and to strengthening access to healthcare, especially mental health care in school. And as I said, this was a passion project of mine. And so I really was able to leverage, my position at the White House in the Domestic Policy Council to really move forward in improving school-based health services and allowing schools to leverage Medicaid. So when I got to DPC, one of the first things that I did was I stood up a coordination meeting, kind of working group, if you will, between the Departments of Education and Health and Human Services to improve communication and the delivery of healthcare to kids in schools. And this coordination work group helped produce a series of letters from Secretaries Cardona and Becerra on available federal resources to expand access to healthcare in schools. And it sparked a new partnership between Ed and the folks in HHS who run school-based health centers. Thanks to this new partnership and funding that President Biden secured, there are more school-based health centers now than ever before, and the partnerships between schools and existing health centers is stronger than ever before. And, I'm really proud of this work that my colleagues and I advanced over the last 4 years because it really laid the groundwork to implement the school-based health services provisions in the Bipartisan Safer Communities Act. These are provisions that were passed, no pun intended, on a bipartisan nature. Both Democrats and Republicans were committed to improving access for children in their healthcare in schools. And, thanks to the efforts of the coordination work group, the HHS team had already started thinking about how to update guidance to states and schools to make it easier for them to bill Medicaid, which allows schools to free up their time to deliver more health care to children. And BISCA, the Bipartisan Safer Communities Act, it's a little acronym that we call it BISCA, it required HHS to issue this documentation and an administrative claiming guidance. So it was really great that the coordination work group had already kind of started and got a leg up on this work. BISCA also provided $50 million in funding to states to study how best to leverage Medicaid and expand or strengthen their existing school-based health services programs. And finally, BISCA required the departments to create a technical assistance center for schools and states to share info and leverage resources. I'm hopeful that this partnership will continue in the current administration. I went on it yesterday, and luckily I still saw the Technical Assistance Center up. So if folks have questions on any coordination efforts between the departments of Ed and the Medicaid agency, that is a great resource to look into. So those are my top of mind advancements. We've had more states actually leverage Medicaid and expand the services that are available for Medicaid funding in schools. And so we've seen a really great movement towards expanding access in schools.
Thank you, Jessica. It's a reminder. I'm hard pressed to think of when I pay my federal tax bill as a taxpayer. I'm trying to imagine a federal tax dollar that is better leveraged and more powerfully leveraged than the Medicaid dollar. We heard from Ann how it leverages state dollars and support. You just described, yet another compelling example of how the Medicaid dollar leverages school-based funding. So this is a powerfully leveraged for whatever faults Medicaid may have in 2020, 25, and I'm sure at the age of 60, we can do better by the Medicaid program. But I hope our civic leaders and political leaders recognize the powerfully leveraged, positive leveraged impact of the Medicaid dollar. And what are some other maybe under-recognized, underappreciated ways that Medicaid policy shapes early intervention and even mental health services for kids?
Yeah, so I'll throw a link in the chat. As I mentioned, we actually have a great short fact sheets. I know this is a lot of information. So we've been trying to put out 1 to 2 page fact sheets, high level information, but with a lot of great links to data and resources. But Medicaid plays a really important role when it comes to early intervention and treatment for toddlers, especially when it comes to Part C. Nearly all states leverage Medicaid to support students in early intervention programs who are also Medicaid eligible, which, as I showed in the graphs, many of them are, to really support access to the services and to help financially support the states in their ability to deliver those early intervention services. So if you're interested, I would definitely take a look at the link in the chat, look up for brief. We have some really great data in there and resources about kind of more specific ways that Medicaid supports early intervention. I would also note that, as Jessica mentioned, we have the Bipartisan Safer Communities Act, which I'm going to get into like Medicaid walk talk, but Medicaid has this really important benefit called the EPSDT benefit. That means that if a kid needs a screening, treatment, service, diagnostic care, and it can be coverable by Medicaid and they're on Medicaid, that they should be able to access it, right? That there shouldn't be limits on that. They shouldn't be making it unduly difficult for them to access that they have access to that service. We know the reality on the ground in terms of talking about improvements is not always that case. This is just really, gold standard benefit. But the Bipartisan Safer Communities Act, again, on a bipartisan basis, instructed the Secretary of HHS to do more oversight of implementation of this benefit and to more technical assistance to states and resources to states to say, hey, how can we work with you or a state-federal partnership to make sure that this promise is becoming a reality on the ground for children and families. So again, they put out some guidance on this. We have a lot more on our website, but this is an opportunity, this state-federal partnership, and we're hoping that we'll see more come out of this administration in terms of follow-up on that provision in the Bipartisan Safer Communities Act, but again, to work with states to make sure kids get the things they need.
Thank you. Let me ask, throw back to Jessica, and I want to ask both you, Jessica and Ann, this question. From each of your perspectives, how did recent federal proposals or budget negotiations signal potential shifts in Medicaid funding priorities and its impact on children? So, and just a reminder for all, CGLR is a nonpartisan organization, as is this event, but we're looking for factual analysis about these proposals, and this is not an invitation for lobbying.
Thanks, Anne. Do you want to go ahead and start, since you kind of already talked about a few of them, but happy to layer on.
And I can talk a bit about process, just for folks that don't live in this space and aren't familiar with kind of the process around this. So what Congress is currently considering is a budget reconciliation bill. And a budget reconciliation bill is kind of a special, different type of bill that has different rules than like a bill that has regular order or normal kind of regular order. And essentially it means, in addition to being able to be passed by a simple majority in the House, in the Senate, where you usually have the filibuster, this has special privileges, this type of bill, and can pass in the Senate under this streamlined process where they can, again, essentially have a simple majority. Now, the bill has to meet some certain constraints around the budgetary process in order kind of to meet those, to have privilege, to get access to those special rules. But we have seen Congress pass these budget reconciliation bills, both on a bipartisan and on a partisan basis in the past. This current effort, I think it would be fair to describe as a partisan effort, largely driven by the majority in the House and the Senate. That includes a number of proposals around tax, around SNAP and food benefits, around healthcare, other things that I know very little about, defense spending, things like that as well. But it is a very large bill. And what we're kind of talking about is one component of it that would specifically reduce federal support or federal spending on programs within the healthcare space, primarily Medicaid, also ACA related programs. So maybe Jess, I don't know if you want to talk a little bit more about any of the specific provisions, but I just want to provide that kind of backdrop for kind of where things are right now.
I think that's super helpful for context. And I think, you know, Anne made a couple of points early on about ultimately what we could see with reduced Medicaid funding in states. You know, since we're talking about schools here, I think the biggest concern that I have is the downstream impact of having less money in state budgets to provide Medicaid will, you know, create holes in their budget. And, you know, we'll see reductions in education budgets, for example. If there is less money for Medicaid, you know, to pay for healthcare in schools, that money is going to have to come from a state's education budget. And, you know, a lot of the biggest proposal, I think, that has gotten a lot of airtime in the majority's proposals that were released earlier this week is Medicaid work reporting requirements. And while that isn't necessarily a policy that directly affects kids because it's applied to adults, it will impact children because it's parents of these children that might get caught up in red tape. They might not be able to apply or keep their coverage, which means that their children will lose coverage. There's some more kind of mundane proposals, which is to get rid of a Medicaid rule that the Biden administration finalized that, you know, prevented children from being you know, disenrolled for non-payment of premiums if their parents couldn't afford their premiums. The rule also ensured that children had access to coverage immediately and they didn't have to wait, you know, in a kind of coverage lockout period. So there are specific challenges and policies that the Republicans in Congress are proposing that will definitely affect kids, both their, you know, from their access to care and coverage and enrollment to states' ability to pay for these services. So I don't know, Anne, if there are other ones that you wanted to highlight in particular, but those were the ones that came to top of mind for me.
No, I think that's a great summary. And there's more in there. I think there's like 30 provisions or something, and there's a lot in that bill, and we're still unpacking it. But as Jess mentioned, I think there's some policies that will have a direct impact on children, no question, and then others that will have this indirect impact of states having less money in their budgets, and how do they make up for that, right? And you could even see things like increase in prior authorizations and like utilization management, right? Where you kind of not necessarily eliminating benefits, but tightening up access to those benefits to kind of reduce spending in a way that could really potentially prevent children from getting the care they need.
Yeah, thanking you both. I mean, this all sounds pretty grim and sober. Is there anything positive in the coming reconciliation conversation that would constructively and positively benefit children and families, or is it mostly the kind of doom and gloom we've been hearing?
I will say that the CBO, a nonpartisan scoring arm of the legislative branch, said that this is going to take coverage away from 14 million people. I'm not sure there's anything positive from any policies that takes healthcare away from individuals.
Thank you, Jessica, and thank you for for not beating around the bush. Let's do this. Let's invite Paula and Mo into the conversation, who, by nature of their leadership positions, are even closer to the ground about how Medicaid affects and impacts children and families. Paula, and Mo, thank you for joining the conversation. Paula from NACI and Mo from Utah. So a third of Medicaid kids across the country are school aged. Half of kids are served by Medicaid across this entire country. 40% of births, and in many states, more than 50% of births are Medicaid supported. And we just heard from Jessica and Ann what the budgetary impacts could be if things go forward in a way that is not constructive for the benefit of our children. So Paula, Ann and Jessica shared their thoughts about how these funding priorities might impact children. What risks do you see for the development of young children if Medicaid access is restricted or even unstable?
Yeah, absolutely. So, I think a lot of the things that Anne mentioned we're concerned about as well, as far as, early intervention services under IDEA, Part C and Part B, so preschool, special education as well, and, children's access to those programs and what that means for the workforce as well. So, we're thinking about how that impacts the children and their development. And we know that when we intervene early, we have the ability to support children for better outcomes in their future. We're also concerned, and I'll talk about this a little bit more in a bit, but about the impacts of these cuts on the workforce, the early childhood education workforce, and the fact that without these supports for children, educators are having a really hard time in the classroom already. So we're really concerned about that. And I know, Mo, I know you were going to start and share a little bit on that as well. So I'll kick it to you and kind of round out in a second here.
Sure.
Yeah,
well,
hey, and Mo, can you speak to Voices for Utah Children also recently released an article entitled "Healthcare Isn't the Only Thing at Risk." So yeah, pick it up from where Paula left off, and what were your key messages in that piece from Voices for Utah's Children?
Well, when you look at Utah, and Utah's kind of a unique state, even though not different than some states, but we have the youngest population in the country per capita. So about 30% of our population is under 18. But we also have an interesting dynamic that about 30% of our population is senior citizens. So we're really concerned because we're going to see cuts at both ends of the spectrum in this case. 50% of our children access Medicaid, so about half of the enrollees in the state are children. And a lot of them are in our rural counties. Now, trying to tie it together with what Jessica and Ann were talking about as well, we just finished our legislative session in March, where we saw our income tax cut. So we've been on a 5-year bender of cutting income tax. And so we have less money now in our overall pool. Once these cuts start going into effect, it's not like we can automatically reopen the budget process. So we're locked into this for 25, 26 at a minimum. And we have already been behind in a lot of these areas. So when Paolo was talking about childcare, Utah has one of the lowest rates of access to childcare, access and affordability. We don't utilize school-based Medicaid to the level we should be utilizing it already. We have one of the highest rates of mental health issues amongst teenagers in the country. So our concern is, number one, the direct effect on children, but the secondary effect is going to be, because of the way Utah is geographically situated, a lot of our rural counties are really deserts already, and we're really concerned about the effect on some of the rural hospitals. We already have challenges there. There are parts of Utah that do not have pediatricians. They only have family practices if they're lucky. Rural hospitals will be at risk in this situation. So we're really concerned about the direct effect on children and families, but also the economic impact that's going to come down the road.
Yeah, and say, unpack that a little bit if you can. Oh, I mean, those of us who've been in and around Medicaid for a long time, I recognize the role that Medicaid plays as an economic engine and in the workforce of a state and a community. Say a little bit more about that for Utah.
Well, you made a great statement earlier, which people should be quoting, is it's one of the best programs in terms of leverage that the federal government has. And so you have a situation in Utah where we have a population that is growing. We need to leverage these resources to the best of our ability. Medicaid and CHIP, in our case, is one of the best investments we can make in terms of a dollar spent in terms of healthcare and future outcomes. And yet, once we start seeing these rollbacks, as like an example is, we're not waiting for the federal government to put in a work requirement. We have right now we're bringing forward work requirements in Utah. There's actually a town hall a legislative hearing tomorrow night. And one of the things that you also touched on is a lot of the people that the work requirement's going to affect are caregivers. So we already have a problem with people not being able to go to work because of childcare problems, because of caring for an elderly parent or for a sick child. Taking away their benefits is not going to help that situation, which is going to hinder the economic output of the state. And that's really something that doesn't get addressed enough.
Yeah, thank you, Mo. Paula, just extending from that observation, talk a little bit about how shift in Medicaid funding might impact the early education workforce.
Yeah, thank you for that. Absolutely. So, at NACI, I'll start by saying this, we ground all of our work in the early childhood educator voice. So I'll kind of be speaking from that perspective today, and from the data that we collect from them on the issues that are impacting them. So that's sort of where I'm coming from in sort of my talking points here. So, one of the things that we know is that because of underinvestment in the childcare sector, about 13% of early educators don't have access to health insurance, and mostly it's because their employers can't actually afford to provide it, and 28% depend on Medicaid for coverage. So of course, this means that their wages are actually low enough for that to be possible, for them to be qualified to have Medicaid. So that's an issue in itself for such a demanding, impactful role. And also for reference, the median wage for early educators is lower than about 97% of all other occupations in the US. So to kind of get into it a little bit here on what we're seeing. So we do these annual surveys that go out to about over 10,000 early educators in the field. And our latest one found that educators with access to benefits, including health insurance, were more likely to report wanting to stay in the field. And we know this is a field that is suffering from a lot of staffing shortages. And, as mentioned, there's childcare deserts and things like that. And they're stemming mostly from the shortages in the workforce. So folks are leaving the field. And so that gives us a little insight there on, the importance of benefits, which, we know. So kind of linking it back to this conversation here today, these large proposals for cuts to Medicaid would mean that more of the workforce, the ECE workforce, would be without coverage. So this not only impacts their health and safety, as we know, their health and well-being, as we know, but also it could make the staffing shortages worse. Because these folks might go out of the field somewhere else to gain benefits and have better wages, which is understandable, right? So this also, will drive the supply shortage, and then we'll see families across the country continue to experience, bad or worse shortages for supply, unable to find childcare. So, I think also linking back to what we said on earlier intervention and special ed services, This also could be something that drives educators out of the field. If there's cuts to those programs that should be there to support them so that they can support the children in their care to address their developmental and behavioral needs in the classroom. And then, of course, kind of linking back to most conversation on the workforce. If we don't have educators to care for the children, to educate our children, about 70% of children under 6 have parents in the workforce. And so we know that's important for folks to remain employed and to not have issues there, in the workforce, continuing their work. So yeah, I think, the last thing I'll say on this is that we're also really concerned about the impact on these Medicaid cuts on state budgets, like Jessica mentioned, and specific to early education as well, because obviously we'll need to be filling those holes that are going to be left by the Medicaid cuts. And how do we do that? Some states are going to have to make cuts to education. So also uplifting that in our work.
Yeah, Paula, so what comes to mind as I'm hearing both you and Mo speak to this, I'm picturing a family. I'm picturing a 30-year-old mom who works either at a nursing home or is an early childhood educator. And she's got a 4-year-old. And I'm imagining in the worst case scenario, perhaps very realistic scenario, what we're talking about here in terms of these cuts that trickle down to New York or Utah. Kind of a triple whammy that mom may be looking at. One is her job may be at risk if the agency is more unstable. Either the entire job could go away, or her health benefits could be impacted. There's the impact on the child, because now some of those economic supports that that the child has in early education and early childhood experiences are at risk. And I'm imagining what the impact of this scenario on thousands and hundreds of thousands, if not millions of families across the country is in terms of the economic well-being in communities. So I mean, it's not hyperbole for me that this would have a devastating reach and impact on young families, whether it's Utah, New York, Missouri, Alabama, or Texas, or California. But Mo, do you want anything you want to on that rather grim scenario? Anything you want to elaborate on that in terms of how local communities in Utah are recognizing this potential impact, or maybe they're not recognizing it yet?
They're not recognizing it yet. I'm glad you brought that up. And I think the challenge is we use a term a lot. We haven't reached the pain point yet. This is the first step, I think, in that pain point, right? Where people are going to start seeing any one of the scenarios you just laid out, start whichever comes first. And then there's going to be that snowball effect, because it's going to be they either lose benefits, a nursing home potentially closes down, a rural hospital closes a unit, et cetera. And then it starts really picking up steam. And the challenge is going to be coming back from that. Like, we can see the immediate impact in front of us, but there's the economic impact that's going to be longer term. But also, we don't talk enough about the long-term impact on the child, right? It's not just that we're going to lose this benefit today, it's going to be the effect on the child as we move forward. The last thing I wanted to come back to, and I apologize, but it was more on the economic piece. The other piece that doesn't get discussed at all in this discussion is we helped run a bill a couple of years ago to make sure that all children had access to health insurance. And the bill would have cost the state $4 million to make sure all children that didn't have insurance would have access to insurance. The state would have saved $9 million just on unreimbursed charitable care. And the hospital systems would have saved close to $50 million on unreimbursed charitable care. That's real dollars. And that doesn't get talked about. We all talk about the cost of, of Medicaid. The reality is, if this goes forward the way it's presented, states are going to get hit with a much bigger bill than just losing that Medicaid reimbursement from the federal government. They're going to pay for it in a different fashion, and that cost, we all know on this call, is much higher than if there was actually insurance in place.
Thank you, Mo. And that leads us to what I'd like to do now is shift to a full panel discussion, bringing Jessica and Ann back to join Mo and Paula. And this is if we can get past our anxiety and worry about what's before our federal leadership, legislative leadership on reconciliation. We had an op-ed, we saw an op-ed this past week, a very thoughtful op-ed by former Oregon Governor Kitzhaber. And in the op-ed, he shares that the basic structure of Medicaid was developed 60 years ago. That structure may no longer fit the needs today. So simply defending the status quo of Medicaid is not enough. And so point well taken, former Governor Kitzhaber. But I just want to ask our panelists, getting past the immediacy of the proposed cuts, from your perspective, what is one actionable, perhaps affordable recommendation you would have about the Medicaid program that would strengthen and not merely defend what we have today? And I'll start with you, Ann. What would you like to see Medicaid do better or more of or differently?
I have a few, but I'll start with one or two, because I think there's absolutely opportunities. Medicaid is a very large program. It's very efficient, but as I mentioned with EPSDT, making that promise a reality on the ground with additional oversight and support to states and implementing that is a big one. Enforcement of mental health parity. We know when we focus upstream on prevention, early intervention, treatment, that we're less likely to have emergency room boarding and very expensive stays in pediatric residential treatment facilities. And yet the OIG has found that there's lots of compliance issues with mental health parity in the private sector, also Medicaid and CHIP. Unfortunately, there's been some actions just as of yesterday on the commercial side, where there was a final rule under the Biden administration that is now not going to be enforced as far as I can tell. I'm sure Jessica can talk more about that. But again, I think focusing on what we can do through EPSDT, through mental health parity to go upstream to more efficient, more cost-effective prevention, early intervention strategies instead of waiting till there's a crisis. We need services there too, because there's always going to be a role for that, but not just focusing on kind of the residential treatment side of things. Again, important role there, but also on home and community-based services. What happens when that child leaves that residential facility? Are they provided with supports when they are going back home? Are there outpatient programs so they can stay at home at night, intensive outpatient? So again, I think some opportunity across systems, also in Medicaid, to kind of do more there. And then lastly, I'll just say, we have seen more and more states, as we've seen in Oregon. When I worked on Capitol Hill, I worked for Senator Wyden, who was a senator from Oregon. So I got to know their model quite well. And they really focus on kind of the health-related social needs. And we've seen more and more states focusing on health-related social needs, thinking about food security, housing security, how do we support kind of a family broadly, recognizing that all of that plays into their health. We've seen more and more states focus on health-related social needs. Again, sadly, the last few weeks, we did see this administration unfortunately pull back on some guidance from the past administration that was kind of guidance to states on, hey, here's some parameters and how you can move forward with pursuing these types of initiatives within Medicaid. To be determined what next steps look like on that, because we still have states that have their active waivers and are moving forward. It's unclear whether they'll approve future state waivers, and if so, what that'll look like. So perhaps we'll see more, again, unclear. But again, I think there's lots of areas where if we have the time and energy to do proactive thinking and not just having to be so reactive to like budget cuts all the time, that we are seeing in states coverage, community health workers, doulas, they are really thinking kind of outside the box. So I could add on more, but just to get us started, and Bob, I'll hand it back to you.
A great basket of thoughts. And by the way, I'm not following the chat really closely, but I just took a peek at it. It's animated. It's pretty much on fire, guys. So a lot of good information and links in the chat, and some high energy, passionate, insightful comments as well. Jessica, your thoughts on what we could in a better place, what we could do to improve Medicaid and not just cut it back?
Yeah, I think mine is less exciting and sexy than what Anne described. I mean, I appreciate the governor's op-ed program. Oregon is not Mississippi or Alabama, and they are in a state that actually is generally, supportive of Medicaid. And so my thing is more of returning and getting back to basics, making sure that the enrollment process is easy for folks, that we can cut back on paperwork, that it is not such a burden to apply for and renew your coverage. It seems pretty kind of as I said, basic, but we saw during the last couple of years with Medicaid unwinding that the more we can automate things, the better it is for people, for states. We were able to retain coverage, pretty well. And so I think it's just kind of getting back to those basics, not only just the eligibility enrollment processes, but, I think one of the things that frustrates me with how Medicaid is set up is that we have states, not to criticize Oregon, but are doing new and inventive things, but they're not paying providers well. It's great if you are trying new, models of care, but if you're not, again, getting to the basics of paying your providers, a sufficient wage or payment to ensure access, that is a problem. And so I think for me, it's kind of returning back to the basics and getting the foundation, getting every state on a level playing field. So, every one of the 75 million people that's enrolled in Medicaid and CHIP has equal opportunity and a fair shot to having great health care.
Thank you, Jessica. Paula, what would you like to see
Sure.
happen to improve
Yeah.
Medicaid?
I think adding to some of what Jessica said here, we hear a lot from early educators. They are grateful that they are able to get healthcare through Medicaid, of course, for them and their children. However, there's so many administrative burdens for them. And so, how can we make it easier for people to access, to get care, and to not have delays in their care and get the care that they need? I think it's important not to just expand the coverage, but also to think about ways to make it easy to facilitate access to it. We think about also things like expanding coverage for the widest range of low-income families, in addition to the reducing administrative burdens, like I said, for those who apply for coverage, and then also boosting sort of the outreach to make sure that people know that they actually qualify for the program. I think is also important, and support them with the enrollment process as well.
Thank you, Paula. Mo?
Well, two things. I'm going to piggyback on what Ann said. We have to somehow get to a proactive system. When you look at it just from an economic model, we are spending so much money being reactive. And so that's where we could modernize the system, looking at reimbursing people for prenatal screenings in more meaningful way, for early childhood screenings, et cetera. So I think developing and expanding on the proactive piece of Medicaid and CHIP. The other thing is, a couple of people mentioned like outreach to the people who are accessing Medicaid. I think we need to educate the general public on what Medicaid is. I think so many people really don't understand. They get the snippets they hear. We've been talking because the work requirements coming up in Utah as a discussion, as I mentioned earlier. And most people, it sounds great if you're talking to someone like people should work if they're getting this benefit. But the reality is they are working. And the people that aren't working are the caregivers, the people with a disability. We know that, right? So I think there's a lot of constant education about Medicaid and the fact that it's a good investment, it's a good dollar spent, and it's producing good outcomes so that we can get more support from the general public, not just the people that are utilizing the product.
Thank you, Mo. And your comments remind me that um, we've never done, when I say we, it's a pretty global we as child advocates who care about public policy. Um, we haven't done a terrific job of the narrative of the Medicaid program. I think for too many decades, it's just been seen as the equivalent of welfare program for in health. It just has never, and I wonder now if we're paying the price for that relative um, lack of storytelling about the power of Medicaid. And so I wonder if we've done a disservice to our communities for those of us who lived in that space. The only thing I would add to the great observations that each of you offered for me, and this is putting my pediatric hat on, I'd love to see an advancement in how Medicaid programs position mental health, behavioral health, and school-based settings more robustly. When I look at how diseases and conditions that impact Americans over the last several decades have fared, and we tend to see improvements over time in cancer treatments, in heart disease, in hip and knee replacements, in treating arthritis and so many other conditions. But mental health has been either flat or worsening in terms of anxiety, depression, suicide rates among young people. I think it got exacerbated during the COVID years. So I don't think we've potential of the Medicaid program around children's mental health. And so that would be my 2 cents on that front. With that, uh, thanking our panel as we move into our Q&A session. I'm going to turn it back to our colleague and great supporter, Michelle Hyman. Michelle, you've been teasing questions out from the chat, I believe, and you're going to offer them up to our panelists. And we've got, I think, I ended this session 2 minutes ahead of schedule, Michelle. I want some props for that. But I think we've got about 15 to 18 minutes for a Q&A with our panelists. Michelle?
Great. Thanks so much. And we welcome you to continue to share 2 cents during the Q&A, Bob. So please feel free to share as we have some of these questions that have come through. So we have an audience that is fired up. They're like this, we want to know what we can do. So what are your thoughts on what can be done to influence the budget reconciliation process right now? What can we do as folks that are vested in this and want to do something? Maybe I'll start with Anne or Jessica.
Well, happy to start. CCF, we are a nonpartisan policy research center, so we do not directly lobby or anything like that, but we do educate. And so we've been putting out a lot of resources, and I've noticed in the chat and kind of other points about, and Mo and others have made this point about the need to just really educate about what Medicaid is, who it serves. I mean, in many states, it's not called Medicaid, right? It's called Badger Care or Peach Care. So just basic information about the role the program plays in different states, who it is serving, information. And there's a lot of great analyses that have come out over the last few weeks and more to come about information about how many individuals in Medicaid are working and how much of potential coverage loss would not be because you're not working, but because, as we saw with the unwinding of the public health emergency and a lot of coverage loss, even for children who we know were likely eligible, just jumping through it. Jessica mentioned that red tape of like being able to log on the portal with the password that gets mailed to you in the mail and it's 10 days late and you've missed your deadline, and then the portal should, you know, all of those things that have nothing to do with whether or not you're working and whether or not you need health coverage. So, you know, I think we, again, are just really focused on educating, and you all have such unique stories, unique voices. And so to the extent that you want to express the things that around education that you think would be helpful for folks to hear, you know, I think that is worthwhile.
And I'll just add, since I'm no longer a government employee or bound by any nonpartisan nonprofit status, to put a finer point on it, I think if you can call your representatives, your congresspeople, your senators, particularly if your representatives are Republican, to hammer home to them the importance of Medicaid, how much it means to you, your community, to your school community, the benefits that it provides to children and helps your state and your schools, you know, kind of, again, just show the importance. I can say my time at the White House, having personal stories was always the biggest and most impactful thing that we could do to lift up a policy change that we wanted to make. And I think the more people, particularly the electeds who are making these decisions during the reconciliation process, hear people's stories and, you know, the direct impact that Medicaid cuts would have to them, to their communities, to their schools, is incredibly important.
That's right. No numbers without stories, and no stories without numbers. Right, Jessica?
100%.
Anyone else want to add anything to that question before we move on?
I would just add one thing. I would urge people to contact their local legislatures in their states because, for example, in Utah, if we're going to bear the burden of these in terms of our budget and cuts to other programs, they should be made aware that people are going to hold them accountable because that's the give and take in this. Yes, contact your federal legislators. I firmly agree with that. But you may have more of an input with the local legislator, getting them to put pressure on federal delegates.
That's great. All right, so speaking of education, and I think one of the things that we've talked about is how you you pull on the Medicaid thread, and that can fray many all across our public systems. And I think one of the things that people are struggling to identify is that what are the proposed impacts across the board, like on parenting programs? How will this impact CHIP? Is there a place that we can go to? I mean, I guess I know your center, Georgetown. Is there another place that we can go to get all of that information? Or if you have anything you can share right now about how this might impact home visiting programs or parenting programs in general too?
I don't know. I can check with my colleague who does more directly in the home visiting to see if there's been any analyses, but we know a number of states leverage Medicaid to support their home visiting programs, right? MICV, which is kind of the home visiting universe, and Medicaid often work hand in hand to support these types of programs. And again, in many states, they leverage Medicaid dollars to pay for all or some of their home visiting programming. So again, to the extent that there's that fiscal pressure on states to be providing some of these services, you know, there's also this dynamic within Medicaid where you have mandatory populations and mandatory services, and then you have optional populations and optional services. And we often see optional services as one of the services that can often get cut first. And so as states are pursuing, again, like coverage of doulas as a provider type, home visiting programs, health-related social needs, even, you know, we're seeing more and more states, blue, red, purple, looking for waivers to cover services for inmates leaving institutions 30-day pre-release or right after we release, so they can have that coverage and that streamlined support as they're leaving kind of a jail or an institutional setting. All of those things are these proactive policies, many of which are optional, that I think we could see really intense pressure on moving forward if there are these levels of, you know, budget consequences for states should these levels of cuts move forward.
Anyone else want to add to that? Okay. So again, in speaking how Medicaid is impacting all of our public systems from early childhood, education, health and human services, what can we do to better align our sectors to defend and improve Medicaid supports? I know one thing that was talked about a lot is effective messaging, and there's a question in the chat here about, are state governments allowed to collaboratively invest in a broad national Medicaid promotional campaign? And if so, what do you think it would take to do such a thing?
I can speak to part of that question and, say that I agree so much with that and, the need to align across sectors to kind of uplift a similar message is so important. And we've seen a lot of that. And I'm grateful to Anne and her team. We've collaborated on a piece to elevate, some of what I was talking about today in regards to the early childhood education sector. And, I think the more clear that we can be in how we're talking about these things, Medicaid is so complicated, right? People are very intimidated by Medicaid. It's confusing, and all of these things. But I feel like all of us collectively have been just doing a lot of that learning, kind of rapid, pace during this time, and we'll continue to do that so we can bring, advocates along with us in doing that learning and advocating together. Using plain language and explaining the direct impacts, I think is so important. So I can share that, and if others want to add.
And I'll just say there are some national groups, right? The National Governors Association, the National Association of Medicaid Directors. They're also within the school community. There's, I've seen the Healthy Schools campaign, have to put a plug in for them. They have really great information about school Medicaid-based services on their website. Some really helpful resources. We worked with them on our Medicaid and students brief. Superintendents Association has, I think, been pretty active in this space. So, I do think that we have seen varying different actors, and we've tried at CCF with most of our briefs to kind of partner with organizations that really focus on that specific issue. So we did a caregiving brief with the Caring Across Generations. We just did a brief about older adults and the role it plays, Medicaid plays for older adults, including seniors, with Justice and Aging. We've worked closely with Family Voices that represents families with children with special healthcare needs. So I think, again, there's been a lot of, engagement across sectors in terms of kind of educating and explaining, again, the different roles Medicaid plays for different populations.
Well, is there anything you want to add specific to Utah on that, or?
I think, again, it's what everybody said. It's an educational component. It's people don't necessarily recognize everything that Medicaid does. Like an example, we looked at our data over the past year, and the largest growth in expenditures was with the disabled population and the senior population in Utah in terms of actual dollar output. And most people don't think of that. They think of Medicaid, as Bob said earlier, like some form of welfare health insurance. And so I think there's that educational piece. We partner with a lot of different organizations, including Ann and Paola's organization from Voices, as well as the Kids Count Network across the country. I mean, there are a lot of groups that are doing this and pushing this narrative. I don't know that we have really come up with a campaign. I think the question was asked, could states organize a campaign? I think in theory they could, but who would be the leader of the campaign, like on a national level? That would be the challenge.
So shifting gears a little bit, and I'll just share that I was actually at the pediatrician's office with my daughter yesterday, and one of the things it came up, she said, "Oh, dealing with the insurance is the worst part of my job." And so this question is actually specific to Dr. Ross and your experience in treating patients with Medicaid. And what are your thoughts on how this impacts providers, pediatric providers, and then also hospital systems, if you have anything you want to share there?
Well, it was a reminder that was put in the chat, quite simply at a 20,000-foot level. What your pediatrician was describing is a symptom of the much bigger policy issue, and that to this day we don't have a national health insurance program for all Americans. And so, that remains the elephant in our American living room, is that problem. And I think, cutting the Medicaid program takes us even further away from that. But I would love to see, and maybe this budget will trigger this, back to Paolo's observation about cross-sector collaboration and coalition. I mean, at this moment, healthcare system executives across the entire country, school superintendents, teachers, doctors, nurses, nurse practitioners, childcare providers, early childhood advocates. We should be in a clarion, powerful, unifying voice about what is being faced by our children right now. And so I have to profess being a bit disappointed that I haven't seen that in a more powerful, compelling coalition as a voice across this country. Maybe we'll see it. But as noted African American author James Baldwin said, I don't do despair, I do rage. And right now merits strategic rage on behalf of our children and families. And maybe that'll be the first step to solving the much bigger continuing problem. We got partly there with the Affordable Care Act, but that job needs to be finished, and we need a national health policy for all of our children and families. So you invited me to get out of my neutral moderator role, Michelle, and now you're paying the price for that invitation.
I'm glad I did. I'm glad I did. Anyone else, anything else anyone wants to share on that topic? No. All right, let me see. There's a couple more technical questions here, so I'll bring it down to a technical level question where for schools or LEAs that have not yet applied for Medicaid funding but are interested, where can they seek assistance, and what is a typical timeline and cost?
I can take that one. I think the best two resources that are helpful, and I think I saw it in the chat, but the Healthy Schools campaign has a great toolkit. And as I mentioned, and I can put this in the chat, the Medicaid Technical Assistance Center is a good resource. Most states, will need to submit a state plan amendment, and that might require legislative action at the state level. And depending on what they want to do, could take anywhere, from 3 months to get approval to longer if it's complicated. It just depends on the paperwork that the state submits. So, it's not something that will happen in a day or two, but it's definitely something that can happen within a few months.
And then just to zoom us back out as we wrap up, are there any last comments that any of you want to share about how we might be able to use Bob's term, fuel our rage, or do something about our collective rage, and not fall into despair? Any thoughts for the audience today?
So I just like to remind folks in 2017 during the ACA repeal and replace debate, it was also through a reconciliation bill. We saw that bill pass the House, move to the Senate, and voted down at like midnight or the late in the evening on the Senate floor. Folks may remember when Senator McCain did the thumbs down vote. And so this process is moving quickly, but there are many parts of the process that still need to happen. I think, it appears that according to what's being reported that they want to move as quickly as possible. But again, it's a reconciliation bill. It has to kind of work within kind of these special rules. That being said, we as we at CCF, I know I shared their website, we do blogs, we do reports, we do analyses, but often when things are moving very quickly, we do blogs, we have a newsletter you can sign up for every week and just get in your inbox on Friday, so you don't have to worry about checking the website, and we'll just highlight the top things that we put out that week. But we will be analyzing the bill and just updating folks on the latest, because again, expecting the next week or two to be before Memorial Day. There's a recess in the House and the Senate to be potentially a very a quick moving time where a lot could be happening.
And I can also add, I think it's important to Bob's point, to remain engaged and remember the power in our voices. So continuing to uplift your voice as educators and advocates, I think is really important. We also have a ton of resources. We have a blog coming out this week as well. And we have a ton of action alerts up already. I saw some of you already engaging with them. So feel free to engage with NACCE around that. We do a lot of advocacy. We also work at the state level, but I understand the importance. I know you understand the importance of engaging right now at the federal level. So we are here to do that. So please engage with us. Reach out to me with any opportunities that you have or that you want to engage in. But yeah, I think staying engaged for sure.
Jessica or Mo, any final comments? No.
No,
All right.
I appreciate everyone's interest. Thank you.
All right. Well, thank you to our panelists, Jessica, Paola, Mo, and Anne. And I'm going to turn it back over to Bob for some final closing comments. And yeah, to wrap us up.
Okay, are you sure, Michelle? Do you want me to do this?
I'm very sure.
Listen, just a big shout out to our panelists. You guys were just terrific. Thank you for your comments today and insights, but also what you do day in and day out on behalf of children and families across this country. This issue that we're talking about, Michelle, today, the issue of the Medicaid program, it's a strategic issue for sure about the future of our children and a thriving, inclusive democracy. It's a moral issue, as came up in the chat. But for me, as a person of faith, it's also a spiritual issue. And I'm going to close with a quote from Isaiah 58. And they that shall be of thee shall build the old waste places, thou shalt raise up the foundations of many generations, and thou shalt be called the repairer of the breach, the restorer of paths to dwell in. Each and every one of you in this campaign network of CGLR and our panelists for sure, each of you is trying to restore a path of thriving and well-beingness for children and families. You are trying to restore a path to dwell in, about a thriving future for our children. And so I just want to take a moment to thank each and every one of you for what you do on behalf of children and families in this country. You are repairers of the breach and restorers of paths to dwell in, and much love for each and every one of you for what you do. Thank you, Michelle, for your support, and thank you to the great team at CGLR for hosting this sobering but enlightening panel discussion.
And thank you, Bob. It was an honor and a privilege to really work with you on today's panel. And you've just been such a great thought leader and partner for CGLR for many, many years. So really appreciate you, and thank you to all of the panelists. And I think we have one slide here just as a quick reminder to join us in some of our future conversations. And with that, we will leave you 2 minutes early. So let's just carry forward today's insights and commit to bold child-centered action. So together we can strengthen Medicaid for the future of our children. Thank you, everybody.